Good morning, this is Deanna Harris, and this video is for Nursing 224. This is for the removal of an indwelling catheter. So what I would do is I would come in and I would knock, knock, knock. Hi, my name is Deanna. I'll be a nurse for today. Can you please state your name and your date of birth? Okay, great. I'm going to go ahead and provide us some privacy. I was just coming in to verify the doctor's orders to remove the catheter for today. Okay, and so we're going to go ahead and remove the catheter because your urinary output has improved since your surgery. And so I'm going to go ahead and just remove it. Do you have any questions? Do you have any concerns? Okay, you don't? Great. Okay, so is it okay if I go ahead and start the procedure? Okay, great. So what I'll do is I'll go ahead and raise the level of the bed to my hips. I'll go ahead and perform hand hygiene. And once I perform hand hygiene, I'll let the patient know that I am going to expose the genitalia area. And so they're okay with that. So I'm going to go ahead and take the covers and roll them back down to the foot of the bed. Now, once I do that, I will go ahead and don some clean gloves. And now that I have donned clean gloves, I'll go ahead and pull up the patient's gown. Once I pull the patient's gown up, I'll look down in the perineum area, and I will go ahead and assess for any redness, any rashes, any skin breakdown. I don't see any redness or skin breakdown, any rashes. So I will go ahead and then drain the residual urine from the bag. Or to the bag. So once I do that, I'll go ahead and put a towel underneath my patient, just in case if anything splatters out while I take the catheter out. Any dribble or anything comes from that, then it'll get on the towel and actually not on the sheets. So once I do that, I'll go ahead and remove the tape from the patient's leg from the catheter. And then once I do that, I will then attach the syringe to the balloon to draw the air out of the balloon. And once I do that, I will have the patient to slowly exhale as I will go ahead and gently take out the catheter. So go ahead and exhale. And then once I take the catheter out, I'll go ahead and look at it and assess it for any blood, any mucus, any signs of infection there. I'll go ahead and just kind of wrap it up maybe with the towel. And I'll go ahead and place that in the reciprocal there, in the biohazard. I'll assess the perineum for any redness, any skin breakdown, and the skin is intact. So I'll go ahead and remove these gloves, and I'll discard those in the biohazard as well. And then I will perform hand hygiene. I'll go ahead and put on a clean set of gloves, and then I'll come over to the bag and pour the urine into a graduated cylinder. The graduated cylinder, I'll go ahead and put that in there so it can be measured. So once we go ahead and do that, I'll go ahead and take off my gloves and put those into the appropriate reciprocal. I'll go ahead and pull the patient's gown back down. I'll go ahead and put the covers back on. I will then go ahead and lower the bed to the lowest position, make sure that it's locked. I'll make sure that the call bell is right beside the patient. I'll let the patient know if there's anything else that I can do for you. Just let me know. I'll reassess the comfort level, reassess the pain level. And if they say they're okay, I'll go ahead and perform hand hygiene. And I'll go ahead and exit the the room. And this concludes the removal of an indwelling catheter. Thank you.